Hi, I'm Greg Fell, Director of Public Health in Sheffield. This is Epidemiology and Situation Report of the 27th of July. So we're a week on from Freedom Day. Freedom Day is probably a misnomer, gives the impression that COVID is all over. The roadmap ended, COVID didn't. So we're a week on from that. Where are we? Whatever happens, there's no risk or consequence-free option going forward, and the decision last week was probably one of the more difficult decisions in the last 18 months. The what happens next is entirely dependent on public behaviour, entirely dependent on that one. So epidemiology now. Currently, 7-day rate is 448 per 100,000. Last week it was about 607 per 100,000. So it's been a reasonably steep decline in 7-day rate, but I don't believe it's real. Firstly, kids aren't in school, so we're not seeing as many lateral flow device tests and then PCR positives that follow. Secondly, the Euro effect was definitely in play. That's now washed out. And thirdly, there's a lot of anecdotal evidence that people aren't testing as much because they don't want to start their summer holidays in isolation. So I think whilst the recorded testing, the recorded case data is on a downward trend, I just don't think the reality actually bears that out. And the REACT and the ONS incidence study bear that out. Going slowly in terms of unlocking was the key to making a difference, and I'd certainly look in various places around Sheffield. There's not much evidence of going slowly. Wearing a mask, for instance, really matters. So consistent ask, if indoors, wear a mask, please. All that said, incidence is definitively beginning to fall in some parts of the UK, certainly Scotland, possibly in some parts of northwest England. So there will be a peak. My sense is the peak for South Yorkshire will be in 2 or 3 weeks' time from now. And whilst the numbers are looking good at the moment, I think that's a bit of a false dawn. There is pressure in the NHS. There's pressure in primary care, there's pressure in social care, there's pressure in hospitals, and a significant proportion of ICU beds have somebody who has serious complications of COVID in there. That's going the wrong way, and that will continue to go the wrong way for a good while to come. So I wouldn't want to underscore the fact that whilst the roadmap is over, COVID is not over. It will be with us for some time to come and is still harming people on a daily basis. Vaccination is providing a significant shift in the impact and the harm that comes from COVID. The vaccination programme continues to go pretty well. That said, there are still more than 200,000 people who haven't yet had dose 2. We need them to have dose 2 soon. Vaccination in double vaccination in over 40s is going pretty well, but less well to date for under 30. So that's a key area of focus, particularly men and particularly males in the early 20s, probably in the east of Sheffield is where we were worried about most. Hard to know how the long term will play out. Sage have published some data on this recently. I think we're all anticipating that there will be a long, slow decline from the current wave. My suspicion is that there will be a ramping up of NHS activity in this space in autumn and winter on account of possible resurgence of COVID. There's still lots of susceptible people out there, aka get double vaccinated, but secondly flu, thirdly usual respiratory viruses. So I do think we will be in for some quite difficult time for some time to come. So all up, roadmap finished, COVID has not finished, it is still harming people, it carries the potential to harm people. You know what we can do, get double vaccinated, wear a mask, if symptoms, stay at home and isolate, please. So on vaccinations, somewhere in the order of 60% of 18 to 24-year-olds have taken up the opportunity of having their COVID jab. That's great news, but 40% haven't. And remember, it's available to all over 18s now. We're really encouraging all young adults to get their job. We're hearing about the possibility of having to be double vaccinated in order to visit nightclubs and other large venues with crowds from September. That may or may not come to pass, we don't know. Regardless, all the more reasons to get vaccinated. It's important that you do so. You protect yourself and you protect others, and you help keep the economy open, which we really, really want to be open. All up, 200,000 people in Sheffield, 200,000 adults in Sheffield haven't yet had dose 2. What we're learning is that the second dose really, really matters. And more worryingly, about 15,000 people aged over 50 haven't yet had dose 1. That's a group I'm particularly worried about. And if you are in that group and you've managed to not be able to book your vaccine yet, please do so as soon as you can. So when fully vaccinated, your risk of being hospitalised falls by about 90%. It doesn't disappear completely, there still is some risk. And we're seeing an increase of vaccinated people being hospitalised because it's not 100% effective, and the sheer numbers will mean that some people who have been vaccinated will still sadly be hospitalised. But it does reduce your risk, and if you are fully vaccinated, you're probably far less likely to be very, very seriously poorly if you are vaccinated compared to if you aren't. So that matters. Lots of queries to me and others about whether or not the vaccine is safe to have if you're pregnant. Yes is the short answer. The vaccine is safe. It cannot give your baby COVID, and it's important to weigh up the risk that COVID can be serious if you catch it later in pregnancy. You can get vaccinated if you're pregnant or you're not pregnant if you're aged over 18, and again, receiving 2 doses is the safest and most effective way to protect you and your baby. And catching COVID during pregnancy can increase the risk of complications, most seriously and significantly preterm birth or stillbirth, which is something that we would all want to avoid. In terms of second doses, I'm hearing a lot about people wanting to get their second dose earlier than the recommended 8-week gap. The NHS recommendation is based on research that leaving a gap of 8 weeks or longer gives a greater and more durable immune response to your body, and that was a study that was published this week, and Sheffield Hospitals was part of the research body. So it's really important that we stick to the 8 weeks and not try and book the second dose sooner, for that reason and many other reasons. If, however, it's 8 weeks since your first jab and you've not yet received a notification to go for your second, then please do make an appointment or pop along to one of the many walk-in clinics, and information is available on our website. This is a short message for those who are shielding, or the clinically extremely vulnerable group. We're a week on from Freedom Day. If I was a shielder, I would think Freedom Day was very badly named. I might not feel any freer. In fact, I might feel less free. There is a sense amongst, and I'm aware there's a sense that some of those people who were shielding, that it's not ended, it's just that the support for shielding has ended and they don't have any rights or protection anymore. I recognise that many in the shielding or the clinically extremely vulnerable group have been at home for long periods. I recognise that many are fearful to come out. I hear this a lot, and I know lots of other people hear it a lot. There was some recent national guidance which was helpful in parts and not helpful in other parts. And I'll try and give you my take on sensible messages going forward. So in terms of what should I do, firstly, get vaccinated. There are coverage of vaccination in the clinically extremely vulnerable is about 85%, so there's still about 15% that aren't vaccinated. For some of that group, there may be perfectly legit medical reasons. For some, it will be an informed personal choice, and I absolutely respect that. And for some, we will have missed you. You will have slipped through the net in various shapes and forms. It's really important that if you want to be vaccinated and you haven't yet been vaccinated, then you do so immediately. The second dose matters. So first dose is not as effective as we would have hoped and we wanted to be in this group. The second dose brings protection up to about the population average, about 80% coverage. It's likely that we'll be doing boosters for those in the clinically extremely vulnerable group in the autumn. I don't know the details on that one yet, but it's very likely that we'll be doing that. So first message, get vaccinated. Second message, same for everybody. Hands, face masks, space between people, fresh air, all of those things matter. All of those things can reduce our risk. There's a lot of talk about personal responsibility. Personal responsibility is important, but we need some collective responsibility. So my ask on everybody is to wear face masks because they protect me, they also protect others, and for those who are shielding, that matters a lot. It's important to understand the risks of being infected. There are risks and benefits on all sides here, and it's pretty much impossible to be very, very precise about it. But today, about 1.5% of the population of Sheffield have COVID. That's from the REACT study and the ONS study. So of 100 people you might come across, 98 of them don't have COVID. Prevalence is expected to go up for a few weeks and then subside. That risk of being infected can be further reduced by vaccination and still further reduced by washing hands frequently, wearing face coverings, avoiding crowded indoor spaces, etc. So we can reduce the risk. We can't remove them entirely, but we can reduce them. So the decision on indoor crowded public spaces is one that only individuals can make, but my ask on all is to wear a mask because they've really made a difference. Only individuals can decide what risk they're prepared to tolerate, and as I say, it's very difficult for me to be really precise about it. Shielding was always a strong recommendation to individuals, never was enforced quarantine. I 100% realise being stuck at home, whether you choose to do that, isn't fun, and actually can be bad for your long-term health. It's important to emphasise the benefits of exercise. Lots of people who are in this group have been stuck at home for long periods of time and not done much exercise. Exercise is good for us. It's also important to emphasise the benefits of getting out and seeing people. We all know that's good for us. All that said, there is merit in taking some extra precautions for some time to come. Just as if I have brittle bones, I might take extra precautions in icy conditions. So it's in that kind of space, but ultimately they are decisions that individuals need to make, and I'll try and characterise the risks as best I can. Lastly, personal responsibility is important. It's necessary, but it's nowhere near sufficient. So there is something that we all need to do around being thoughtful of others, strongly asking and encouraging all places to ask their customers, their employees to wear face coverings indoors. If an individual who's shielding has decided that they wish to work from home, I'd encourage all to respect that decision, because ultimately the risks and benefits on all sides are quite difficult to quantify and people need to make some decisions for themselves.